morning. It is Tuesday. I need to make this quick because I'm running into work. But I have kind of a weird Tuesday. Normally I'm off of work, but today I'm going in for a client that needed to reschedule. This is her wedding hair, so it's going to be super exciting. But I will get off of work. I'll run to the grocery store. Then I have to go to a doctor's appointment, a periodontist appointment. I thought that would be interesting to share with you. So let's run into work. Gotta do that first. So I went into work, I did my client's hair, and this was her wedding hair, so it had to be perfect. And honestly, it turned out so beautiful and we were both so happy. But the rest of the day got kind of a little bit chaotic. So I'm coming to you a couple days later to fill you in on what's going on. I had to make a periodontist appointment, which is, I believe it's just like a gum dentist. I've had one of my front bottom teeth for years that's had a little bit of gum recession on it. And I went to the regular dentist on Monday and he was like, I think it's time that we get that taken care of. We don't want you to have your tooth fall out or bone loss or whatever. He referred me to a periodontist, which I was going to after this work day, but they called me and they were like, hey, we have an appointment an hour earlier if you're available. And being that I am someone who works off of appointments, I love when clients are able to come in early when we offer that to them. I was like, yeah, totally, I'll be there. So I drove over there right away after work. Didn't really have any time to fill you in. So I'm filling you in now. I go in and first of all, everybody there was so nice, so kind, such a lovely little office. The hygienist, I'm assuming she was a hygienist, she got me all settled in and then went and got the doctor. She came in, she was so nice, very good chair side manner. And then she was like, okay, we're gonna just go ahead and take a look at everything in your mouth, see how everything's looking, and we'll kind of go from there. She goes in, she's checking every little spot on my gum line, top, bottom, inside, outside. She's saying some things that I think I understand and some things that I have absolutely no idea what she's talking about, which makes sense because I'm not a periodontist. So after she finished doing all of that, she was like, okay, I'm just gonna go make a couple of notes, look over all of this, and then we'll go from there. She was like, do you mind if we take a photo of your teeth? I was like, no problem. She took a photo and then she went to just make a couple notes, a game plan, and came back to speak with me. And she was like, so you definitely have that little bit of recession on the one tooth. And then the other 5 of your front teeth have very thin gums. She was like, I'm just gonna show you the photo because that's gonna be a little bit easier for you to understand kind of what I'm talking about, to have a visual reference. So she pulls up the photo and she's explaining that my 6 front teeth have really thin gums, and on the photo you can actually see my teeth through my gums. So she was like, yes, you have this one tooth with the recession. Those other 5 teeth in the front, if we don't do them now, you're gonna have to do them down the line. It's kind of inevitable. So she was like, my plan would be to just do everything right now, do all 6 teeth, get it done with, then you don't have to worry about having this done again. And in my mind, I was kind of like, oh my gosh, 6 teeth? I was just planning for 1. She just thinks it makes sense to do all 6 all at once. They're all in a row, so I don't know if that means they just do one big graft or they do 6 little ones. I don't really know exactly how it works. Then she kind of explained the procedure. If you're not someone who likes to hear medical things, maybe the rest of this video isn't for you. So for those of you who do like to hear medical things, it is non-sedated, which I have the option of no sedation and just numbing, or an oral sedation that I was talking to my best friend who's a hygienist, and she said basically it's a really, really, really high dose of an anti-anxiety medicine. And I think I'm opting for the no sedation option. What they will do is they will numb my mouth to the extreme, and they are going to remove tissue from the roof of my mouth to create a graft for all the gums down here, to create new gums. And then they created, she said it's essentially a retainer, not for my teeth, but a retainer that sits on the roof of my mouth so that just food and my tongue are not brushing up against this wound that has been stitched shut on the roof of my mouth. Thankful for that. I'm gonna have that. And then obviously all of these 6 teeth, I'm gonna show you. again, if you're not a tooth person, if you're not a medical person and you don't want to see, just maybe skip ahead a little bit. One more thing before I show you. I do have a lip tie, which I don't think I said anything about in the last few minutes. I have a lip tie, which is part of the reason why I'm having this issue. The lip tie is pulling down on my gums. So we're also gonna release the lip tie. So let me just show you. I'm not gonna be able to talk and do this, but it's gonna be this tooth to this tooth. This one right here, this is the one that has like a lot of recession, and then you'll see my lip tie. So you all just got to see a nice little view of my mouth. She was saying for the first like 2 to 3 days that I really need to do everything that I can to not move my bottom lip. So she was like, for the first 2 to 3 days, I recommend that you're not really talking. I was already planning on taking off of work, but I was like there's no way that I could even try to work because I have to talk to my clients to at least know what they want to do with their hair. Soft foods for 10 days. The only other thing was part of the reason why this one tooth specifically has a little more recession is because my teeth have shifted since I had braces, which I have a permanent retainer on the back of my teeth, but obviously my teeth needed to go somewhere regardless of that. So she said once everything's done and healed that I really should consider getting Invisalign because it doesn't make sense to do all of this and then not correct the reasons why it's happening. Invisalign will also probably be in my future. So that was basically the whole appointment. I did get my impression for my retainer thing when I was there. I do plan to document the experience, probably not so much the actual procedure, but I pretty much share everything on here, so I'm sharing this too. So yeah, that's the update. I'm getting oral surgery from now it's like 11 days. Didn't think that that was gonna be happening this year and didn't think it was going to be quite as extensive as it's going to be. Be sure to like and subscribe if you haven't already, especially if you're interested in following this little mouth surgery journey. Thank you again so much for watching. I will see you in the next one. Bye guys.